Another day, another set of long lines at COVID testing sites as the number of cases climb across the country. This is what it looked like at sites in Hillsborough and Pinellas counties. Yesterday, the one in West Tampa, the one on the left side of your screen right there, tested more than 2,500 people. Nearly 2,400 showed up the day before. Odds are you might know someone right now with COVID. Experts told our Liz Crawford with the Omicron surge, it will get worse before it gets better.
Angela Goldfarb says she was fully vaccinated and boosted 3 Pfizer shots.
I followed all the rules and still got it.
She thinks she got COVID while working at an outdoor holiday party. Her 2-year-old and 8-month-old also ended up getting sick.
At least being vaccinated, I feel like I can see a difference, or I hope, because I didn't get very ill. But at the same time, it's incredibly annoying that I got sick.
A sentiment being felt by thousands across the state of Florida.
Cases and positivity are just increasing at a very rapid rate.
According to the latest report from the Florida Department of Health, there were more than 125,000 new cases last week in Florida, up from 29,000 the week before.
Astonishing increases in just the past 2 weeks alone.
Researchers out of the University of Florida came up with 4 different Omicron scenarios for the state by adjusting a few different variables. Bottom line, all scenarios point to the Omicron wave growing slowly through December, rapidly in January, and peaking in February.
Because a lot of people are getting together at this point in time.
Dr. Salami is hopeful we won't see a tidal wave of hospitalizations and deaths thanks to various levels of immunity.
We don't have a lot of people who have never been infected and never been vaccinated. A lot of people have some immunity built up. That will work in our advantage.
You know, we hear a lot of different predictions about this pandemic, so let's take a deeper dive into how the medical experts come up with these projections. When it comes to USF's Dr. Salami, he says that the models are all about data. He pulls together data from the Florida Department of Health, the CDC, and the Department of Health and Human Services, and then he puts it in one place, making it easier for us to digest. He calls himself a nowcaster, not a forecaster. The projections out of the University of Florida take into account 3 main variables: transmission, disease severity, and immune escape, which is the ability for Omicron to evade immunity due to natural infection or vaccination. That's why researchers there came up with 4 different projections by adjusting those parameters.